The term arthritis is this generalised term referring to any inflammation of the joints. There's lots of different types of arthritis, but the two most commonly diagnosed are osteoarthritis and rheumatoid arthritis. So osteoarthritis is triggered by sort of commonly like minor injury, and it sort of triggers the body's healing process, which leads to this build-up of fluid inside your joints and the formation of new bone, and which can lead to new swelling. Chemicals in that joint fluid can lead to the thinning of the joint cartilage. So it's this mechanical injury that the bones are rubbing up against each other, causing inflammation and pain as a result of that. Some people can experience symptoms like swelling, tenderness, or this like grating or cracking sound when you move your joints. Rheumatoid arthritis is different because it's an autoimmune disorder, which means that the pain and inflammation is sort of triggered by the body's own inflammatory response. So it's attacking its own joints and has this same sort of acute pain and swelling in your joints. The severity of osteoarthritis symptoms, for example, can vary greatly from person to person and even between different affected joints. But the most commonly affected joints are sort of the hands, spine, knees, and hips. So one reason for the pain and stiffness of osteoarthritis is thought to be due to the nerve endings in and around that joint becoming more sensitive. The nerve endings can sometimes become more sensitive and then continue to cause pain even when the inflammation has been managed. For rheumatoid arthritis, the condition usually affects the hands and the feet and the wrists. And it has that same painful joints, but it also, because of its autoimmune in nature, then there's all these other symptoms that are sort of associated with rheumatoid arthritis, of this extreme fatigue, and in a flare-up you can have high temperature, sweating, it can cause poor appetite, nausea, weight loss, and in some sort of severe cases the inflammatory response is so severe that it can cause chest pain, which is obviously a signifier of it being an incredibly severe flare-up. Arthritis is thought to be affecting around 10 million people in the UK at the moment. It can affect people of all ages. It's not just a sort of a result of getting older as such. And I think the term wear and tear injury is often used a lot, but it is incorrect. It's a damage that has been sustained and can be sustained as a result of injury at any age, for example. Osteoarthritis is the most common type of arthritis in the UK, affecting around 9 million people here. And it often develops in their mid-40s or older. And it's more common in women and people with a family history of the condition. However, as I said, it can occur at any age as a result of an injury, or be associated with other joint-related conditions such as gout or rheumatoid arthritis. So rheumatoid arthritis affects more than 400,000 people in the UK. It often starts when a person is between 40 and 50 years old, but like I say, it can start at any time. And women are 3 times more likely to be affected than men. Rheumatoid arthritis is normally treated with immunosuppressants, surgery for joint replacements, NSAIDs, so like anti-inflammatory painkillers, and other painkillers alongside, such as paracetamol, and in some extreme cases, opioids. It's often used alongside sort of supportive treatments like physiotherapy, and often the understanding is that the more movement is better for you. Osteoarthritis is often suggested as lifestyle changes to help manage your condition, such as, as I said, regular exercise, losing weight if you're overweight, wearing suitable footwear, and using special devices to reduce the strain on your joints during everyday activities, such as like a wrist support. As cases become more severe, then there's a similar treatment as rheumatoid arthritis, in the sense that you can have surgery to sort of replace joints, anti-inflammatory painkillers, other painkillers alongside, and physiotherapy. But cannabis medicines can be helpful for the management of inflammatory pain in arthritis, that nerve sensitivity, pain signaling that we've discussed before. And in the instance of a rheumatoid arthritis, it can help manage with this sort of fatigue symptoms, as well as the mood elevation and anxiety and stress reduction factors that go alongside living with a chronic and painful condition such as these.